what should be the role of the employer in the healthcare system? You know, in the last election, we had a really vigorous debate about whether employers should be providing healthcare at all. So that's the first question. And then second, within that framework, should there be kind of a backup health insurance plan that the federal government runs to catch people who are not able to get insurance through other means, like an expanded Medicare or like a private insurance exchange? So we'll throw that out to the group. Thoughts about the employer's role?
Didn't employer provided health insurance show up like in World War II?
Yeah.
Because they couldn't give anybody raises.
Right, exactly. There's wage control, so it's a relative, we'll give them tax incentives, so we allow them to have some non-wage compensation, so we'll provide these benefits. That's when it popped up. It's a relic of World War II, and it's not necessarily fitting today's economy, where people are not staying with the same employer for their entire careers. I'm big on portability because we do have the mobility, and I see my kids moving from job to job when they get older, and I've moved through a couple jobs just in my short career. But the question is, on the role of the employer, why can't we move to more of a defined contribution type of model like we have with our pension system, where more companies have been moving from a defined benefit where you had a pension program to a defined contribution where they say, we will contribute X amount to your health insurance, then you can go out and purchase it, and it doesn't matter where you're employed because you're getting the same contribution from employer to employer.
I would argue that the economic well-being of this country would probably launch exponentially if employers would get out of the healthcare business completely. It's a social welfare issue. It's not, and then if they wanted to be competitive as they did in World War II, maybe do some kind of supplemental kind of insurance program. But I think in a civilized society like ours, which is changing as much as it is, that's frankly not the employer's job anymore. That's the people's job, the government's job.
And while I would like to see a safety net or a government option, what concerns me about that is with those small businesses and other companies that are struggling and not sure whether or not they're going to maintain their health insurance, if you just move to a system where you say, okay, well, we'll add this government option that you can buy into, how many businesses are just going to say, well, wow, the government's going to take care of that, I can move that off my books and won't have to provide insurance?
But we would also have to have changes on what we're buying.
Yeah.
Because the system that we have today, it's a competitive business system between Blue Cross and Aetna and Cigna, that the back end would have to change too, because there's no way that individual, if we went to a model like that, employers wouldn't be as generous, I don't believe, as ours is probably today, if we went to a system like that. So the dollars that you as an individual or a family would have to leverage and buy quality health care, the whole model would not work. So that on the back end, the model that we used, and so a model that's out there that insurers have already had to embrace and adopt is the military plan. And it's good and bad. Some people like it, some people don't, but it is a sort of Medicaid, Medicare model. It insures millions of people around the country. It provides access and resources when they're abroad. So we have a working model, and we also, we have a new leader in that area who knows that system well. But there could be, in terms of looking at effective models that are already in place, that could be something to review. And the best part of that, of course, is that they've already tested that model within Cigna. So health insurers had to go to battle for those lives, for those insurance spots. So that's already there.
Well, that would be good. My concern about having a government insurance program is that it would be more modeled on the Medicare program, where it literally takes an act of Congress to get a change in your benefit formula. Or why did we have such a big debate years ago about prescription drugs? Because Medicare was the only insurance program in the country that didn't offer prescription drug coverage. It literally took an act of Congress to get that done. And Medicare beneficiaries are paying premiums for Medicare Part B. They're paying premiums for Medicare Part D, the drug benefit. They're paying, many of them are paying premiums for Medigap coverage, and then there's still holes there. You know, if you were trying to sell Medicare on the open market, the government wouldn't allow it.
True.
I think there are other benefits to having something that's portable and is not tied to the employer, to Sean's point about, you know, people changing jobs more frequently now than say our parents did, is that it maybe would improve continuity of care, so that if you don't have to change a doctor because your health plan has changed, then you can stay with the same doctor. That doctor becomes more familiar with you and your health history, your medical history, and I think the benefits there, you know, there's probably been studies on the benefits of staying with a single provider over time.
And you bring up a great point with continuity of care as something that can transition more into preventative care as well, because then you have a provider that knows your health history and knows how to make a plan that works for you,
Yeah.
and you become more of a partner with your medical provider in determining, you know, a healthy lifestyle for you. And I know that kind of gets to that last question, the discussion point of, you know, promoting healthier lifestyles, and that continuity of care is part of that.
If we were the king and queen of Spain, what would we recommend as an organization? I mean, what plan would we recommend?
It's a very good question.
Well, I think it'd have to be a combination, because I don't think you can rely on consumers to pick the choices, because right now people are making choices to play Russian roulette, and I'm going to buy groceries or other things. So it's almost like car insurance. It's got to be something that everybody has to have, but at the same point in time, it can't be as difficult, as John said, to make changes in that. And I think overall, I mean, it's even too complicated, once again, for bright individuals to get into medical, because they don't want to deal with all the hassles. So we're not giving the same level of doctors that are going to be out and giving their lives to the community. And to that last point on the critical care, I think making decisions. My mother is in the hospital with cancer, and she's having to make decisions on whether she's going to leave or not. And I think she decided she was not going to put it in my father's. Nothing against him, but how could he take care of her? So I think all these choices that are too complicated, we just need to make simple, that people can make choices until everybody can have some type of coverage at their discretion.
Do you think that, and this is just open to the group, that we should mandate that people have health insurance? Should it be required?
I think everybody needs to have some type of health insurance, tied to what it is.
I think it's good in theory, but we do that with auto insurance, and how many people are driving around without auto insurance?
And then we saw, so when we went to the CHIP model, at the state level, we said that children had to have access to medical care for basic immunization for blah, 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 blah. And we just saw an amazing uptick in the health of children as they went into kindergarten. Think about, I mean, and that's at an age where, generally speaking, you're healthy. You get kind of basic everything. Just think if we could apply that same model. And I mean, it will have great financial returns if we could do prevention and screening across the board, you know, at 40. I mean, even if we looked at other different kinds of things. But mandated always sounds so negative. But if it could be a marketing term, enabled system of healthcare.
I think that gets to the point of why are they, we all agree that having insurance is a good thing, and it's good for your health and will provide better outcomes throughout your life. But why are people who maybe could afford it are not purchasing? What, even if if they're in the individual market and they're making decisions, as he said, I gotta buy food, I gotta pay rent, I gotta do this, I gotta do that. I'm gonna game the system and just assume that I'm not gonna get sick for a while. And then if I get sick, then maybe I'll go on Medicaid or buy insurance. We need to find a way to make insurance an attractive option for people, something that they want to buy.
Well, I think right now the issue that we struggle with, and as people, is not the 21-year-old who said, I'd really rather go buy beer than pay on my employee's health policy, because I'll never die. And it's the 38-year-old guy or gal who switches jobs or for some reason or other gets out of the system and can't get back in because of high blood pressure, or 20 years ago they went blind in one eye 10 minutes or something. Those are the people that I think would be highly motivated to buy the insurance, and the rest of them, quite honestly, I know this sounds mean, it's kind of like if you're caught without car insurance today. Either get it, or if you have a wreck, you lose everything, and I hate to be that cold about it, but if it's there, and if it's accessible, and if it's affordable, and you choose not to get it, that's your issue. But right now, the issue is, a lot of people would pay for it, a lot of people need it, a lot of people want it, and can't get it.